We have all these busy people's time, and our media is here. Thank you for being here. So we better get started. We were waiting on one more mayor. As she arrives, we'll factor Mayor Thomas into the schedule. But good morning, everybody. How are you? Mayor Tim DeGeeter, thanks for hosting us today. And Mayor Gallo, nice to be just next door. I am Chris Ronayne, Cuyahoga County Executive, and I'm happy to be here to celebrate another milestone in the continuance of the mental health crisis response program, one that is sure to result in better care for more of our residents. I want to acknowledge, as I've already mentioned, Mayor Tim DeGeeter, who's going to speak in a minute about how Parma and Parma Heights with Mayor Marie Gallo are coming together to be our next adopters of this mental health crisis response program. So thanks, special thanks to Tim DeGeeter and Marie Gallo, the mayors of Parma and Parma Heights. I also want to acknowledge David Weiss, who's going to speak, who's with us today. He really was originally, with his team, the brain trust behind the mental health crisis response program. Mayor Weiss, we remember visiting you on a cold, snowy day in 2023 and seeing what you were doing with Annette, then with, I believe, Recovery Resources, and now with our team. We saw the proven results in Shaker Heights, and our hope was to scale this mental health crisis response program. And with your support, we've done that. We've done that with the cities of South Euclid, Richmond Heights, University Heights, Cleveland Heights, and of course, Shaker Heights. But today, we scale to Parma and Parma Heights. I want to also acknowledge, I see many members of the Parma and Parma Heights City Council here. Thank you. I see you, Councilman Schuman. Thanks for being here today. The support matters from across our communities. We're also going to hear from Shaker Heights Police Chief Wayne Hudson, who was formative in the first of the program, and also Parma Heights Police Chief Stephen Greene, who's going to be an adopter as of today, and Parma Fire Chief Mike Lasky. Also, we couldn't do this without the ADAMHS board, and we're grateful for CEO Scott Osiecki. I also want to say that the team behind the teams that does the work and does really the collaboration, want to give special shout out to Fire Chief Sweeney of Shaker Heights. Where is he? I saw him on the way in. Thank you, Chief. And also here locally to Director Bob Corey, who I saw on the way in, Safety Director Bob Corey. Is he behind me? Give him a shout. All right. And to Brandy Carney, who's out here with our public safety team, Jill Smilek. Thank you guys for being so formative and getting this together. And also our Deputy Police Chief of Parma. You know, it's the team that comes behind this together. Bob, we were just calling out to you. Thanks for your support, helping put this together. So the mental health crisis program has had a tremendous impact on the way our communities respond to those in need of mental health support. And I'm proud to see this model expand to serve more residents across Cuyahoga County. We call this a co-responder model. It embeds a full-time mental health specialist, social worker with our police and fire departments, our EMS departments, to improve the response to those suffering from mental health crisis. I really appreciate the men and women in law enforcement, our first responders, our police, our fire teams, our EMS teams, and our county sheriff's department. All of you that are on the front line as first responders, just want to really acknowledge you at this moment and say thank you. As we speak with first responders, we hear that, and that's been my pleasure to work with first responders through three jobs, 3 different police departments, and now a sheriff's department. We keep hearing from our first responders in law enforcement and fire safety and EMS that they really appreciate the added support. That when somebody is having a mental health crisis, it's an all-team effort to help somebody get the services they need. So I want to acknowledge and appreciate those who wear the badge so proudly in our community and are our first responders. Thank you. And thank you for your openness to bring other resources to bear that helps actually solve problems. And we are hearing a proven success story. You're going to hear from Mayor Weiss about how it's worked in other communities. And so I want to say to Tim DeGeeter and Marie Gallo, the mayors of Parma and Parma Heights, thank you for giving us a shot. Tim, you brought this to me at a school board meeting we were at with a bunch of school superintendents, and you said, we want to give this a try. Mayor Gallo and I want to give this a try in Parma and Parma Heights. And that's what we look for. At Cuyahoga County, we try to mine for ideas and good ideas and pilot programs that are working, and then we pilot them, and then we scale them. Our hope in Cuyahoga County is to bring, with persons like Mark Casselberry, who I wanted to introduce also from the county council. Thank you. You're going to speak here in a minute, but Mark's a new leader on the county council. As county council looks at our program, we're hoping for the ultimate approval of $3.5 million from the Opioid Mitigation Fund to continue to scale this program. As I've talked to Director Carney, our hope actually is over the next 5 years to scale this throughout Cuyahoga County. So to work first with these first 7 communities and add 100,000 persons in our continuum of care through Parma and Parma Heights. It's a heavy weighted population down here in Parma and Parma Heights. So we're going to actually have a touch point to 100,000 new residents of Cuyahoga County with this program. So to provide streamlined coordinated services that are tailored to the needs of individuals, we are fostering a healthier and safer community all around, while improving the safety of our residents and first responders. Just think, if you had a family member in need that was suffering from a mental health challenge and had a crisis, had a breakdown, and something happened that put them in, the throes of law enforcement, how much you would appreciate if also they had a mental health specialist and social worker with that person in charge. So I think for all of us, it's a team effort to really improve the wellness of people in our community and respond with care and respond with precision in the ways in which we can really help people find a better path. So I'd like to take a moment to express great appreciation one more time to first responders. This is all about giving you backup support, giving you someone to work with in a community to help make people well. Our police officers, our firefighters, our EMS workers work tirelessly every day in order to serve the public, and we recognize your efforts and we salute you. So I appreciate everyone that's here, and it's now my honor to expand the program and call upon our mayors and our chiefs and some others that are going to speak today. Right now, I'd like to introduce here my colleague, Councilman Mark Casselberry. Thanks, Mark.
Thank you. Good morning. Thank you, everyone, for being here. I want to thank County Executive Ronayne, other elected officials, alongside you for the announcement of this important expansion of the First Call program, which will now provide services in Parma and Parma Heights. This expansion is a statement about who we are as a county and how we respond to our neighbors in crisis with care, professionalism, and dignity. Expanding into Parma and Parma Heights builds on the success the county has already seen in communities like Shaker Heights. In just 1 year, this program has helped divert hundreds of individuals from jail and hospitalization and connected them to real long-term care. Alongside Cleveland Heights, Richmond Heights, South Euclid, and University Heights, this program proves that cross-community collaboration works and that public safety can be about enforcement as well as empathy and support. For Parma and Parma Heights, this expansion means a real immediate impact. Families will have access to trained mental health professionals responding in real time. Law enforcement will have the tools they need to de-escalate, assess, and connect individuals to care. And most importantly, people will be met with compassion. I have to say it's not always easy for our cities to collaborate and coordinate across borders and budgets, but this effort shows that our mayors and city council members are willing to do the hard work because we all know that the people we serve deserve it. This program goes beyond the system and can have a countywide impact as well. It reduces strain on our jail, emergency rooms, and our officers. It builds trust between the public and those sworn to protect them, and it ensures our most vulnerable residents don't fall through the cracks. I want to thank the county executive, our partners at the ADAMHS board, Parma Mayor Tim DeGeeter, Parma Heights Mayor Marie Gallo, and our respective city councils for supporting this work financially and helping us bring this together. Our police and fire departments and behavioral health teams, you're the heart of this program, and I thank you for saving lives one call at a time. I want to thank everyone for being here today, believing in this partnership, and I want to thank you for helping to make sure District 4 is part of the future of mental health in Cuyahoga County. And I want to thank everyone that knows how important this is. I've campaigned on this. It's affected me personally. I want to thank you all for supporting this.
Thank you, Councilman Casselberry. And I have to say, I know that, Mayor, we brought Councilman Casselberry from Parma to the county, but he's still serving his constituents in just a bit of a broader way. And it's great to have your partnership. And thank you for your support for mental health on the county council. It's going to be my honor here just a second to mention Tim DeGeeter and ask Mayor DeGeeter to come up. But I wanted to call out, as Councilman Casselberry mentioned, the program is called First Call. And that's something we worked with Mayor Weiss and the first 5 mayors on to get this program launched. But the obvious in that name and First Call is we're trying to make sure that the right call is directed to the right response. So I'd be remiss if I didn't acknowledge also our dispatchers in our police, fire, and EMS that are the ones that actually take that call in and have to make that call about the proper call, you know, and what to do. So to our dispatchers, and please extend that team to your teams, they're critical in the system of response. If they make the call to dispatch mental health and social worker with an officer, it goes a long way to solving a problem. So thanks, and here's to our dispatchers. Okay, without further ado, again, he brought it to me. He said, I heard about this program out east that was happening in the Hillcrest communities, and Mayor DeGeeter said, me and Mayor Gallo want to get together and scale this in our communities. So here's to you, Tim DeGeeter. Please come on up, and thanks for hosting us today. Thanks, bro.
Morning, everyone. First, let me welcome you to Ohio's 7th largest city, the city of Parma. Before I start my formal remarks, I just want to also recognize Councilwoman Schuman, our chiefs, both police and fire, dispatch coordinator, communication director as well. As the county executive mentioned, I first heard about this program through the First Suburbs Consortium. Actually, all mayors are a part of that, but Mayor Weiss, Mayor Gallo, and I are on the executive board. And we were on a Zoom call back in December where Mayor David was mentioning the success they have out in Shaker Heights on it. So A couple weeks later, all the mayors here were with our superintendents at a first superintendent's breakfast meeting. Our county executive was there speaking about this program. And I'm just like, why am I keep hearing about this? This is something we should be looking at. So I went back to our safety director, Bob Corey, who's sitting up front, and said, hey, I think we should really take a hard look at this. This sounds like it's getting good results. And Bob looked at me and said, so you know, we are already in formal talks with Brandy at the county. So the moral of the story is hire good people to make you look great. So with that, thank you, County Executive, for your leadership on this vital initiative and for bringing us together as partners across Cuyahoga County. I'm proud to stand here today with my fellow mayors, council members, community leaders in support of the Mental Health Co-Response Program, a program aimed at addressing a challenge in our communities, responding to those in mental health and substance abuse crises. In the city of Parma, every year, hundreds of calls are made to our police and fire departments, calls that involve individuals in the midst of a mental health crisis or struggling with addiction. While our police and firefighters are skilled in handling a range of emergencies, some situations call for more than just a traditional emergency response. These individuals in crisis require specialized care that addresses not just the immediate crisis, but also the underlying issues and long-term recovery. Too often, our already busy police and fire personnel are forced in the role of social worker, working to connect those in need with appropriate resources. That's why, in partnership with the county, Parma Heights Mayor Marie Gallo and I are launching the Parma and Parma Heights Mental Health Co-Response Program. This initiative pairs a licensed social worker, our crisis response clinician, with first responders so that we can bring the right expertise to the scene when it matters the most. Our goal is simple: to provide the right response at the right time and to help individuals in crisis avoid unnecessary involvement with law enforcement or emergency rooms. Instead, we aim to connect them with mental health services and community-based solutions when they need it the most. Our crisis response clinicians will work side by side with police officers, firefighter, and paramedics in both emergency and non-emergency situations. As important, our clinicians will continue to follow up with their clients to ensure they are getting the services they need for a sustained solution. I want to thank the dedicated police, fire, and dispatch teams in Parma and Parma Heights for helping to develop and lead this program. Their commitment reflects our shared belief that public safety is not only about responding to emergencies, it's about building a healthier, more resilient community. This is just the beginning, and we're excited to see the positive impact this partnership, which goes with our city motto, progress through partnerships, that will have on the lives of the individuals and families we serve. Thank you very much.
Good morning, everybody. I'm Mayor Marie Gallo with the City of Parma Heights. I thank Cuyahoga County Executive Chris Ronayne for the opportunity to speak this morning about the importance of this program. I also want to thank all of our first responders for the amazing work they do every day for our residents. It is a 24/7, 365-day-a-year effort, and their work should be applauded. I'm here with my Police Chief Steve Greene, Captain Mike Lesniak of our police department, who experience and deal with mental health issues every single day. I'd also like to thank District 4 Cuyahoga County Councilman Mark Casselberry, and especially the support of Parma Mayor Tim DeGeeter for their support and collaborative spirit with the City of Parma Heights on this program. As local mayors, we are responsible for serving our residents and providing a good quality of life for all. This program directly improves response to those having a mental health crisis, meeting people where they are with a diversified approach to mental health assistance providing a licensed independent social worker dispatch with first responders in selected appropriate situations. We all agree that there is a growing need for immediate mental health services in our communities, both on-site and in real time. In 2025, mental health remains a significant concern, with statistics indicating that 1 in 5 U.S. adults experience mental illness annually, and 1 in 6 youth have a mental health condition, with only half receiving treatment. Financial stress, burnout, and political division are major contributors to psychological distress for adults. Furthermore, there's a concerning trend of young adults, especially those aged 18 to 25, experiencing increased rates of serious mental illness. 1 in 6 youth have a mental health condition, but only about half receive the necessary treatment. College students report high rates of mental health challenges, with a significant number dealing with anxiety and depression. Depression prevalence is higher in females than males across most age groups, with adolescent females experience it at least twice the rate of their male counterparts. And suicide remains a leading cause of death among young people, particularly those aged 10 to 34. Those numbers tell a compelling story and speak to the importance of and need for this program. It is important because it links Cuyahoga County communities like Parma Heights to available resources. As local mayors, it helps us build livable communities, allows us to grow collaboratively and cooperatively while addressing both public safety and public health concerns. As a direct example of regional cooperation and collaboration, it also takes some of the immense pressure off of our first responders, whether they be police, fire, EMS, or our dispatchers. Parma Heights recognizes the need and importance of this program, and we are proud to join forces with Cuyahoga County and with the City of Parma in supporting and implementing it. I also want to make a comment, and I echo what Mayor DeGeeter told me a while ago. These jobs as mayors are hard if you care, and they are 24/7 jobs. And we need to face issues like mental health head on. We can't hide behind it and look the other way. And it is our jobs as mayors to serve the public across the board, regardless race, color, ethnicity, and any mental health issues. And that is a service we provide, and that's what we are in this job for. So thank you. And at this time, it is my pleasure to introduce Shaker Heights Mayor David Weiss, who played a role in beginning the program in this community in 2022.
Good morning, everyone. Thanks for coming out. I too will be brief, but I couldn't miss the opportunity to thank some of the people who really have made this day possible. As in anything, notwithstanding the accolades that Chris will give to me from time to time, which I appreciate, the bottom line is this is a team effort. This is only done through the hard work of our first responders and acceptance and support of the program. It only happens through a community or in communities that believe that this is a necessary service to our communities and to our funders that make this all possible. So I'll just give you a real quick background of how this came about. In 2020, a type of program like this. It was really a team effort by City Council, our police and fire chiefs who are here today, Hudson and Sweeney, other staff, concerned residents, and we all came together to say, how could we provide this service in an economical way and provide a service that has not been provided. So we had several goals, but 3 in particular that came to were high on our list were: 1, regionalism, providing an opportunity for communities to participate together in a program, make it cost effective, and then provide an efficient deployment of services in our communities. So in 2022, we started a pilot program through a partnership with Metro Health that, as you've heard, embeds a mental health professional and peer support provider in with our first responders. That program, the pilot lasted for about a year and a half. We found were 4 other communities that said, let's let Shaker maybe try the pilot, and then we can go from there. Which early on, I had the support of my fellow colleagues from Cleveland Heights, Richmond Heights, South Euclid, and University Heights. As Chris mentioned, we call this the First Call program because there are really sort of 2 key components. One is crisis assistance, real time, any time of the day or night, as an initial response to a crisis situation, mental health crisis. And then secondly, the LL stands for local linkages. This is not intended to be a long-term provider of services. We already have great services at the county, but what we do provide is immediate connections. And it provides an opportunity, as it's been mentioned, to provide our first responders an opportunity to respond where they are needed. But when mental health issues are the sole or primary issue, we have a response, and our first responders can move on to other life and death issues that they deal with every day. So this program has been in 2024, we expanded it. And the results have been terrific. During our pilot program, Shaker dealt with over 560 referrals. And then in the years with the 5 communities, we've already provided services to 2,180 residents of our combined communities. So in closing, let me just say we are pleased to be here. We were pleased to be a small part in putting this together. I thank everyone that made this possible, particularly my two chiefs. Couldn't happen without them. And so we look forward to adding Parma and Parma Heights to the club, and we hope to see it continue to expand. And I know with Chris's support, we will be doing that. So thank you. So with that, I turn it over to the next speaker, my friend and colleague, Kim Thomas, the mayor of Richmond Heights. So you're up.
Good morning, everyone. The mayor said he was going to be brief, and he really wasn't. So I am going to be brief for the sake of my voice. First of all, I just want to thank everyone for being here today. And Chris, thank you. Thank you for your support. Thank you for investing in this program, this needed program. And also thank our other partners who have invested in this much needed program. Now, for Richmond Heights, we have a population of 10,800. And what we have noticed is an increase in calls regarding behavioral health. And so for us, it is a life-saving program to help our community, but it also provides us with experienced, licensed professional that can really handle those calls. Now, I am very appreciative because I have my chief with me, Chief Williams. It takes the heavy lifting off of my first responders. In this way, they can do what they do best, and that is community policing. So again, I am very thankful and grateful for you, Chris, for this program. And welcome. The other thing that I always think about now that we have this program in place is the funding. So it is my hope that we can continue to have this program, but I feel pretty confident because this is definitely what is needed. So again, thank you all for being here. Everything that needs to be said about the program has already been said, and so I'm not going to carry on, but I am going to turn it over to Shaker Chief Hudson.
And I will be brief because I forgot my glasses and this is small writing. Good morning. I want to thank Chris, Ronayne, and all the elected officials for having us today. As someone that has been in law enforcement for over 30 years and someone that has a family member that suffers from mental illness. I professionally and personally know that it's important to have a caring response model when it comes to someone experiencing a mental health challenge. Someone experiencing a mental health challenge is exactly that. It is a health issue and not a criminal justice issue, as we've always treated it in the past. Our first call team is having tremendous success in Shaker Heights, responding to mental health challenges, which frees us up, myself and Chief Sweeney and our teams, to do things that we do in our community best, which is respond to other calls. I'm going to give this one brief story, then I'm going to take my seat. In Shaker Heights, when we have a mental health call, we have a minimum of 2 law enforcement officers and 3 fire department personnel. So that's 5 personnel to respond to 1 call. We had 1 individual in our community in 1 year called 177 times. Now imagine all those resources, all that time spent 177 times. When our first call program personnel got involved and started linking that individual to services, we don't receive those calls anymore. So we can concentrate on what we do best, which is fight fires, help other emergencies, and community policing. So thank you again. Welcome Parma and Parma Heights. I'm sure you're going to have great success. And I'll turn it over to Parma Chief Greene. Thank you.
Thank you, Chief Hudson. Parma Heights and its neighbors have long looked for partnerships to continually strengthen our service to the community. Recently, together with the City of Parma and Cuyahoga County, we looked closely at our mental health related call volume in both communities, as well as the expense of providing targeted mental health response. As a result, we believe this is an important service that both communities can provide more efficiently in partnership rather than independently. In looking at other programs, including the wonderful program in Shaker Heights, we believe embedding mental health professionals in our dispatch center, which we also share with the City of Parma, and the police and fire departments will provide immediate help to our citizens in need, as well as provide a ready resource for our officers, dispatchers, and firefighters who cope with trauma on a regular basis. As I began my career some 33 years ago, the first week I responded to a report of a male having a mental health crisis. This was unexpected because it was not within my personal frame of reference. That night I was blessed with the ability to communicate effectively with someone who I had never met before in a situation I had never encountered before. 20 minutes later, this was not only a learning experience for me, but also a positive one because of due to the good outcome. And our goal is to increase positive outcomes, provide more effective service, reduce the number of repeat calls, and connect people in crisis with the resources that they need most. As we are open 24/7, police officers often find themselves in various non-law enforcement roles. We all enjoy helping people. That's why we've chosen policing. As such, we might be considered generalists. We look forward to having a specialist focused on mental health to assist our officers and firefighters with the mental health aspects of our calls for service. In supplementing our officers' skills to work through a mental health crisis, we'll be able to better help those who are victims of crimes and those with other needs. I want to thank County Executive Ronayne, Mayor DeGeeter, and Mayor Gallo, and all the community partners, Shaker Heights, who pioneered this effort in Cuyahoga County, and all their partners. Thank you. And now Parma Fire Chief Lasky.
Good morning. Thank you, Mayor. Thank you, Mayor Gallo, Executive County Chris Ronayne, and all the county and community partners who are working to make this program a reality for the City of Parma and our neighbors in Parma Heights. As Fire Chief, I have seen firsthand how our crews respond to mental health related calls. They're a regular part of our responses every day. Whether it's someone struggling with substance abuse, a person facing psychiatric emergencies, or an older adult with symptoms of dementia, our firefighters are first on scene to deal with these calls. Let me share with you some of the calls that we have responded to over the past 18 months where our firefighters and police officers have responded and dealt with mental health issues. 102 overdoses, 659 psychological emergencies, 65 suicide attempts, and 192 cases of alcohol use. Our firefighters train extensively to provide life-saving care, but some of these emergencies need a different type of expertise. Someone trained specifically to help navigate the community of mental and behavioral health and provide follow-up case management. That's why the new co-response model is so meaningful to the city of Parma and Parma Heights. By embedding a licensed clinicians alongside our first responders, we're not only improving how we manage the situation in a moment, but we're creating a path of long-term support for these individuals. These programs allow us to de-escalate more safely, reduce the strain of our emergency rooms and jail systems, and treat individuals with dignity and compassion during some of their most vulnerable times. As important, our clinicians will continue to follow up with our clients to ensure they are getting the service they needed and provide a long, sustained solution. It is an enhanced approach to public safety, and I'm proud to be a part of the Parma Fire Department in Parma Heights to take this program on. To our firefighters, paramedic, police officers, and most importantly, our dispatchers, thank you for your professionalism and commitment, and I appreciate your support for this program. Thank you. It's my pleasure to introduce the CEO, Scott Osiecki, from the ADAMHS Board.
Good morning, everybody. So once again, I'm Scott Osiecki, the Chief Executive Officer of the ADAMHS Board. Just so in case you don't know, the ADAMHS Board is responsible for the planning, funding, and monitoring of public mental health, addiction treatment, and recovery support services delivered to the residents of Cuyahoga County. We don't provide direct services, but we partner with a network of community providers, agencies, and organizations to ensure that individuals and families receive the proper care and support they deserve. Today's announcement on the expansion of co-responder team services being made available to the residents of Parma and Parma Heights experiencing a behavioral health crisis is another notable example of our Cuyahoga County community's commitment to behavioral health. The ADAMHS Board is supportive of alternative response models like co-responder teams that ensure people in a behavioral health crisis receive timely, compassionate care when and where it's needed most. I commend all the municipalities that have worked together thus far to expand crisis service and build a more responsive, community-centered system of care. Such available services illustrate our community's commitment to providing a response to behavioral health crisis that is timely, compassionate, and delivered directly in the community, oftentimes resolving the situation and providing, of course, a warm handoff to additional services. Crisis response teams help de-escalate situations, connect individuals to services, and promote recovery without relying solely on law enforcement and other first responders. This is a public health response rooted in compassion, not punishment. What started in Shaker Heights has evolved into a true model for regional collaboration, crossing traditional municipal boundaries to provide needed crisis response for members of the community living with mental illness or addiction issues. The ADAMHS Board is very proud of our initial $500,000 investment provided in 2024 for the original program launched in Shaker Heights, as well as the funding and support of several other community partners, which helped pave the way for today's growth. We have seen how effective alternative crisis response can be, including in the board's own care response pilot program that we also have as well. The expansion of this program allows that alternative crisis response is effective, essential, and should be prioritized in all communities countywide. The ADAMHS Board is encouraged by the progress and remains committed to supporting the expansion of the crisis continuum of care in Cuyahoga County. By working together, we can certainly continue to improve outcomes and provide hope to individuals and families in need. You know, I also have to say that Cuyahoga County is very fortunate that we have a leader like Chris Ronayne and Brandy Carney and folks who really, and County Council, who have really invested in the mental health and addiction and treatment care of the people of Cuyahoga County. Not all communities have that, so really you should be congratulated. So I will turn it over to Chris.
Thank you, Scott Osiecki. Thank you, Parma Fire Chief Mike Lasky, Parma Heights Police Chief Stephen Greene, Shaker Heights Police Chief Wayne Hudson, Richmond Heights Mayor Kim Thomas, Shaker Heights Mayor David Weiss, Parma Heights Mayor Marie Gallo, and Parma Mayor Tim DeGeeter. Also, again, Councilman, thank you, Cuyahoga County Councilman Mark Casselberry. We appreciate you all today and just the collaboration that obviously you see in front of us. We thank the Parma Heights Fire Department for hosting us here in station number 2 today. Excuse me, I said Parma Heights, I said Parma for hosting us today. He is quick though, he doesn't miss a beat. I'm just noting the collaboration. All right, so to the Parma Fire Station number 2, thank you guys for hosting us today. I also want to say we see Shelley from Metro Health out here today. Thank you. You're part of the first response team and really your work in the mental health circles. We appreciate the partners at Metro Health and also all of our area hospitals. I guess I'd be remiss while I'm on a roll. I do want to thank Roscoe from the Parma Police Department here. He's our four-legged friend out here today. Thanks, Roscoe. Give a wave. He did. All right. And so back on a serious note, listen, our work is about a healthy Cuyahoga. It's a constant refrain that we have. It's about the health of our people. And today substantially moves the needle on a healthier Cuyahoga. I know that our current public safety director, Brandy Carney, knows this well, and our past public safety director, Bob Corey, who moved over to Parma, you guys know this well, and you worked to get those opioid mitigation funds in order. And now, thank you, Brandy, we're deploying them. We hope, Mark, with your support at County Council and your colleagues, we hope to deploy this $3.5 million to bring on other communities into this equation. I got to thank once again Tim DeGeeter, Mayor Parma, and Mayor Gallo from Parma Heights for just hearing a good idea, seeing a good idea at work in Mayor Weiss and Mayor Thomas's communities and 3 other communities and saying, let's scale it up in our community. So thank you, mayors, for stepping up to do that. And again, you heard from our chiefs, our fire chiefs, our police chiefs. You heard about what they see in communities all throughout Cuyahoga County. Addiction knows no bounds. A traumatic experience knows no bounds. It knows no boundaries. Attempted suicides know no boundaries. Alcoholism and drug addiction know no boundaries in our communities. But if we're true about what our work is about, which is service, we aim to serve to save lives, right? And as we save lives, we change lives. And you on the front line, our first responders, know that well, and that's what you do. Today, we hope is another major tool in your toolbox to help you save lives and get people on a positive path to their own wellness. So this work matters. As Mayor Gallo said and quoted Mayor DeGeeter, it's hard work if you care about it. And I appreciate that so much, guys, because that is so true. This work matters and it's hard. And you got to have heart, as Mark Casselberry conveyed. You got to have heart in this, and it matters to all of our families and our community members. Today, we add another 100,000 residents under this ecosystem of co-response, of care. That's a huge, huge day. And we thank you guys for stepping up. As we've worked in 5 eastern suburban communities and now our southern suburban communities, and also with the city of Cleveland, we've got about half the county population covered under this service. But the work ahead is to cover the rest of the county. And that's what we look forward to, using those funds to help scale this to every community, all 59 in Cuyahoga County. I'd be remiss if I didn't thank the George Gunn Foundation. I don't think their team is here today, but they were the early seed money that helped us scale what Mayor Weiss started in Shaker Heights out to 4 other communities. And now 7 communities altogether working in Cuyahoga County. So this is a good idea. It was worth scaling. And in our county charter, we talk about things like regional collaboration. Our director of regional collaboration, Chris Alvarado, is here today. He works that every day. The idea is learn a best practice from one community and scale it to another. It's exactly what we're doing today. I would end by saying thank you to the staff members that have worked to make this happen. We all, as your elected leaders, serve this public, but we work with tremendous talented teams on staff. Thank you guys for putting this together, all of you. And lastly, once again, to our first responders, thanks for caring. You guys get in this business to serve the public, and you're serving them even better with this co-response program today. Adopting First Call in your communities here in Parma and Parma Heights adds real bench strength to the work we do every day. So to all of you, we'll team up to make this happen in every community in Cuyahoga County and be about a healthier, more well Cuyahoga County. But again, this story continues today in Parma and Parma Heights. Thank you, mayors, and thank you, team members. Let's go. We'll take questions offline if the mayors want to give a question or two. Maybe we'll take a photo before y'all leave. Thanks, everybody.